My name is Charlotte Pecot. Good afternoon. I'm a fourth-year medical student at Tulane University School of Medicine. I will be discussing our project comparison of the original and updated American Academy of Orthopedic Surgeons clinical practice guidelines on distal radius fractures today. The AAOS publishes and routinely updates these guidelines in order to provide up-to-date and evidence-based recommendations regarding the treatment of common musculoskeletal pathologies. The aim of this study was to analyze the included studies within the original and updated CPG on distal radius fractures and compare their characteristics. Manuscripts of studies included in the 2009 and 2020 versions of the distal radius fractures clinical practice guidelines were reviewed. The level of evidence of the study, date of publication, journal publication, country of origin, and funding status were analyzed and determined for all of the eligible references. And then t-tests and chi-squared tests were used in comparing continuous and categorical outcomes between CPGs. In terms of results, we found no significant difference between the mean level of evidence or proportion of high quality studies included between the two CPGs. The mean time from study publication to inclusion within the clinical practice guideline was between the 2009 and 2020 versions was 9.97 and 11.06 respectively, but these differences were not statistically significant. There was also no difference in the percentage of studies that had been published within 5 years of the guideline publications. There was no difference in percentage of studies conducted at institutions outside of the United States. The only statistical significant difference that we did find between the 2009 and 2020 versions of the guidelines was that the percentage published in hand and wrist specific journals was much higher in the 2020 guidelines at 22.7% compared to the 10.8% of the 2009 references in the guidelines. So the characteristics of the original and updated clinical practice guidelines are similar in regard to quality of evidence, proportions of studies with international or domestic origins, as well as similar in regards to funding sources. There was no statistically significant difference found in mean time from reference published to inclusion within the guideline. These findings suggest that the research used to guide these clinical practice guidelines had not necessarily improved from 2009 to 2020 in terms of level of evidence or recently published research. This limited availability or suggestion of such could be steps to guide future research and to support funding and research efforts in specific pathologies. Some of our next steps in this project would be to compare the findings we found in distal radius fractures with other guidelines on pathology. So comparing the differences between the original and updated of distal radius fractures compared to the changes within carpal tunnel syndrome, for example. Any questions?
So while we discussed the analysis of all these results, is there just one takeaway message that you can give us from these conclusions?
Yeah, basically, I think our takeaway, we were expecting the level of evidence to sort of improve over the updated guidelines from 2009 to 2020. And from our data, from what we interpreted, there was no improvement in the level of evidence or more recently published research.